You're watching McLaren Port Huron's Today's Health, and we're talking with Dr. Bashar Samman about congestive heart failure. All right, Dr. Samman, how do you make that diagnosis?
Well, the diagnosis, the first part is really the history, the symptoms. When somebody comes in and complains, I'm getting short of breath when I move around, I've gained weight, I have swelling, I can't sleep, those are signs of heart failure. Shortness of breath, as you know, is a very common complaints. People that have lung problem can be short of breath. There's a lot of reasons for out of shape. So there is but we start with the symptoms. I mean, we have to have a suspicion that this person has heart failure. So the symptoms is the first part. If somebody comes in to see me having problem breathing, having swelling in the legs, has gained weight recently, can't sleep, then heart failure is at top on my list. Once that is done, then we go to do some testing, some diagnostic testing to look at, one, do they really have heart failure or not? And two, and most importantly, why do we have heart failure? Because the treatment depends on why we have it. So one of the things we do, a chest x-ray would tell us if there's fluid in the lungs, some blood test. There's some markers on the blood test that would tell us if there's signs of heart failure. If they're absolutely normal, something we call the BNP. If it's absolutely normal, then the likelihood of heart failure is very low. On the other hand, if it's elevated, it could reflect heart failure. After we do that, an ultrasound of the heart, or what we call an echocardiogram, will give us a lot of information. One, it will give us information about the function of the muscle of the heart. We talked about the muscle being weak, being stiff. It will give us information about the valves, which valves are working well, closing, not closing, and all those information will try to help us not only diagnose heart failure, but most importantly find out why do we have heart failure, because the treatment is different between one person and another. There's some common treatment for all people with heart failure, but then we have to be more specific. If my heart failure is from valve problem, then I need to focus on fixing the valve, otherwise I'm not going to get better. So those are the first. Once I get those testing, then I can start to go down different route. If I'm suspicious of blockages in the artery, then a stress test or a cardiac catheterization helps. If I'm worried about the valve, either a CAT scan, an MRI, or a cardiac catheterization will help. So the first step is find out, one, yes, do I have heart failure, and try to eliminate or focus more on certain diagnoses and try treatment.
So as you're talking, I'm thinking the treatment obviously is going to depend on what's causing it and what needs to happen for this patient.
I mean, the treatment, the way we look at treatment for heart failure is really two parts. The first part, we need to treat the acute symptoms.
Okay.
If somebody comes in, I'm short of breath, I can't sleep at night, I've gained 10 pounds over the last 3 weeks, I have swelling in my legs, my shoes don't fit anymore. The treatment is the same. We need to put them on the medication to get the fluid off, make them more comfortable. Medication to control their blood pressure. Once that is done, then we go to the second stage, is why we are in heart failure. And then we need to look at the cause of heart failure and try to fix that cause. If we have a weakness in the muscle of the heart, that's a reversible weakness. We need to look at why it's weak. What can we do to improve it? As you remember I said earlier, the muscle is a pump. And the whole idea of whatever we're going to do, we're going to maintain the muscle pumping as strongly as possible. So whatever we want to do, that's our goal.
Can you prevent heart failure?
Well, then we go back to what I call stage A, people that are at risk for heart failure, but not yet have the symptoms of heart failure. What do I mean by that? People that have high blood pressure are definitely at a high risk of heart failure. If I treat their blood pressure early on and maintain a good control of their blood pressure throughout, then the risk of them going on to heart failure is much less. People that smoke, if they stop smoking, because smoking is going to increase the risk of having blockages in the arteries, which is going to increase the risk of having heart attack and then heart failure. So absolutely, can I prevent it 100%? No, but I can make it less likely to occur if I can work on the risk factors. And I didn't talk a lot about the risk factors, but a lot of them are the common risk factors of heart disease. I'm talking about hypertension, I'm talking about diabetes, smoking, high cholesterol, lack of physical activity, poor diet, overweight. Those are the things we know increase our risk of having heart disease and increase our risk of heart failure. So if we can see a patient in stage A and work on their risk, modify the risk before they move on to stage B when we start to get symptoms, that's where we want to be.
Do the patients always come in stage A because the symptoms are dramatic enough?
No, stage A is when they don't have symptoms.
Oh, okay.
And sometimes we see people in stage, in the beginning when they have some symptoms, but unfortunately a lot of us, if we don't see the doctor on a regular basis, and I'm not talking about having to see a cardiologist, see your family doctor, because any doctor is going to treat your blood pressure.
Okay.
If you go on a regular basis, you follow the recommendations of not only the medication, but the lifestyle modification, which means the exercise, the eating, avoiding what we should avoid, eating what we should eat. All of those things are going to help not only your blood pressure, but they're going to reduce your risk of going on to have symptomatic heart failure. So moving forward in the heart failure, you want to stay as asymptomatic as you can. Not only that, you want to stay at a level where the muscle is still normal. You have risk to deteriorate the muscle, but you're not there yet. That's where we want to catch people. And that's why it's very important to follow up with your doctor. If he says you have high blood pressure, treat it. If he says you have diabetes, treat it.
Okay, well, we're going to take a break, and then we're going to talk a little bit more about patients that are sicker with congestive heart failure.